name's Jade. I'm going to be your nurse today. I'm just going to perform an assessment on you before you leave. First, I'm going to wash my hands, perform hand hygiene, and I'm assessing the room for any safety issues or visitors. Before I begin, Ashley, can you verify your name and date of birth for me?
Ashley Smith, June 4th, 1996.
Okay, Ashley, do you have any allergies?
No.
And are you having any pain today?
No.
Okay. Can you tell me the year?
It's 2021.
Can you tell me the month?
It's April.
And can you tell me where you're at?
The hospital.
Okay. I can tell by her speech that her words are clear. They're not slurred. Her face is symmetrical. I'm just going to have her smile for me. Okay, her smile doesn't show any signs of drooping. Her oral mucosa is pink and moist. Her teeth are intact. I'm going to assess her pupils. So Ashley, I'm going to have you look at my nose for me, and I'm going to shine a light. Okay. And then I want you to follow the pen. Perfect. So her pupils are equal, round, and reactive to light and accommodation, and they're about 3 millimeters. I'm also going to very quickly grab your vital signs. So of course, her blood pressure is 120/80, her pulse is 70, her temperature is 98.6, her respirations are 16, even and unlabored, and her O2 is 98% on room air. Comparing those to last night, I don't see any changes. So now that I've assessed her face, I'm going to go ahead and first assess her heart and lung sounds. So starting with the heart, I'm going to listen. Then at Herb's point, we're listening. And of course at Herb's point, S1 and S2 were noted, no other sounds noted. Now next we're going to move on to the lung sounds. Okay, now we're going to listen on the lateral side. Deep breath for me. Deep breath for me. Deep breath for me. Then on the other side, we're going to listen. Okay, and if you lean forward for me, I'm going to listen on all 10 points on the back. Take a deep breath. And after listening to all of her heart and lung sounds, her lungs are clear, the rise and fall of her chest are symmetrical, and yeah. Now I'm going to assess her upper extremities. So I'm going to first look at her arms. I don't see any IV sites. Her skin is pink and warm to the touch. Her bilateral pulses are +2. Her capillary refill is under 3 seconds bilaterally. And I'm just going to ask you to squeeze my fingers for me. Great. Push up against my hands. Push down against my hands. Wonderful. They're both equal in strength and circulation. Next, I'm going to listen to your abdomen. Before I do that, are you having any pain or tenderness in your abdomen?
No.
Have you had any difficulty voiding?
No.
And when was your last bowel movement?
Today.
Today? Also as well, have you had any nausea, vomiting, or diarrhea associated?
No.
Great. So I'm going to listen to all 4 bowel sounds, starting in the right lower quadrant, going clockwise. Okay. Now her bowel sounds are noted in all 4 quadrants, and they're normal active. I'm going to palpate next, and you just let me know if there's any tenderness. Okay. No tenderness noted. Her abdomen is flat and non-distended. Next, we're going to move on to the lower extremities. Are you having any pain or numbness or tingling with your upper or lower extremities?
No.
Okay. So with your lower extremities, I'm also assessing the skin. I don't see any edema at this time. Checking capillary refill, which are both under 3 seconds bilaterally. Now to assess strength, I'm going to ask her to push up on my hands, push down on my hands. Both legs are equal in strength. I'm going to assess her skin turgor very quickly. No tinting noted. And then we're going to look at your skin as a whole. So she's got no IV sites, no peg tubes, no drains, no dressings. And I'm assessing all of her pressure points. Make sure there's no redness or tenderness noted. And there isn't. And of course, before I leave today, how has your stay been at the hospital?
It's been good.
Wonderful.